Yes.
Now you're live.
Am I?
Yep.
Hi, good evening, everyone. This is Dr. Schilling from Secoya Health, and bring this week's Wednesday Wellness Minutes. And this week we're going to talk about, has your doctor gotten it wrong? We were debating, has your doctor got it wrong or gotten it wrong? What's proper English? Type your message below and let us know if you're an English major. At any rate, I'm going to do my best to slow it down. I got another comment this recently that I speak way too fast and I use words that are way too big. So what I'll do is I'm going to slow it down and just keep it as plain as possible. This week what we're going to talk about is having information provided to you from your doctor, medical doctor typically, but there are plenty of physicians or doctors that are not medical doctors who provide information that's not accurate based on what you're dealing with, because they're using symptoms to determine what is going on. So they're taking the symptoms you're experiencing and putting you in a box. And nobody wins when you get put in a box.
Sean Haig says more big words.
More big words. Sweet, Sean. All right, thanks, buddy. So one of the primary reasons that malpractice suits are filed in this country, because this is a very litigious or sue-happy country, we'll put it that way, is because of misdiagnosis. That's one of the leading causes. Doctors fail to provide a diagnosis. They might even provide a delay in the diagnosis, or maybe they provided one that was the wrong one, like they told Bob that he had stage 4 terminal cancer and he should go home and collect his affairs. He's going to die in 2 weeks. He ends up doing it, and they find out it wasn't actually his diagnosis. It was Freddie next door. These things happen. These are very real scenarios. Johns Hopkins did a study of like 55,000 malpractice claims and found out that nearly 2/3, the 74% or something like that, were actually misdiagnosed. And they found out that the top 3 misdiagnosed cases are cancer, vascular things like blood vessels, strokes, heart attacks, things like that, and then infections. So out of all of them, out of the 55,000, 74.1% were misdiagnosed, and most of them were 3: cancer, blood disorders or blood issues, and then infections. So just keep that in mind. These are pretty amazing stuff as far as what we're dealing with when we think about how we can get misdiagnosed. You always want to have more information. So I'm going to give you as many tools as I can this evening as far as what to do, what to ask, how to approach that. But another study by the National Academy of Medicine studied like 12 million misdiagnoses in this country. Okay, 12 million in this country. So that's like 5% of the population, which 12 million sounds bigger than 5%, but when you think about 12 million people having a misdiagnosis, that's a big problem, because it can lead to further development of problems. It can delay your actual healing process and cause you to develop something even worse or more egregious. It can cause life-threatening issues and things like that. So diagnostic errors cause about 80,000 deaths in this country every year. And, that's a lot of people. That's like... Well, we live in Woodbury, and it's about 65 to 68,000 people. So that'd be like the town of Woodbury dying off every year. Yeah, I mean, that across the country, 300 million people, it doesn't sound like a lot, but if you're the one that gets the misdiagnosis, you're going to find that pretty important. Okay. If you look at the ICD, the International Code of Diagnostics, I believe there's a long term for it. There are like 10,000 different diagnoses. Just think there are 10,000 boxes that can put you in out there. Okay. And there are 200 to 300 different symptoms that they associate with these different conditions. They have overlaps, like about the autism spectrum disorder now. People are putting this under the spectrum. It's like an umbrella. Well, we don't really know what's wrong with you, so we're going to put you under this umbrella, because then we can treat you with certain things, which is what happens with most issues and most diagnoses. There's something called the medical standard of care, and the standard of care says that if you walk in with X, Y, and Z symptoms, you get A, B, and C drug. Not really helpful. So when you think about, 10% of patient deaths are resulting from misdiagnosis. The question you have to ask yourself is, do you want yourself or one of your loved ones to be that 1 in 10? Because when it sounds like 1 in 10, you're like, holy cow, I could be 1 of 10 people standing in a room and receive a misdiagnosis that ends up resulting in my death or their death or someone we know. So you have to ask yourself, what game do you want to play? Now, without question, if you are dying or need your life saved or kept alive, you go to see a medical doctor, you go to a hospital. If you're looking at quality of life and improving how you feel and how your function is and getting the most out of life, that's when you go see a natural health care practitioner. Okay? Some of the things to think about moving forward. If you have, so for example, a lot of people in their twilight of their lives usually have multiple conditions, like they have a heart doctor and they have a GI doctor and they have a kidney doctor, so urologist, cardiologist, and things like that. But there's no continuity of care, which means no one is managing from a global standpoint what your condition is or how they're interacting or interrelating and stuff like that. So you could have a medical doctor for your cardiology, for your heart, giving you medication here, your urologist giving it there, but they never really talk to each other. And so if the pharmacist doesn't have their wits about them and paying attention to what drugs are being prescribed and what the cross reactions are, then you're going to have a problem. It's statistically proven that once you have 4 medications of any sort, you are guaranteed to have an adverse reaction. Guaranteed. I would probably submit it's 1 to 2, but typically you go in, you get a medication, you get a side effect, you get the medication, and you see how that whole thing goes. If you get your blood, urine, and saliva sent off to a laboratory, those are laboratory values. Those are an indication. They're going to use that information and compare you to other people. All right. Now, I don't know about you, but for me, I don't want my health compared to anybody else, because there may be similar gene pools within my family, but nobody else on this planet is necessarily the same as me. They haven't experienced the same stressors, experienced the same lifestyle things, eaten the same way I have, had the same challenges. So we use kinesiology because kinesiology taps into your body's innate intelligence. It says, okay, what does the body know about its optimal level? And then it gives feedback based on that. And it's kind of hard to explain with words, but it's easy to show. But you get the idea. So find some way of getting biofeedback from your practitioner, whether it's your medical doctor or some other type of practitioner like us or someone else, because lab values are not going to get you the information you need. Managing your symptoms is typically what you see in the pill for symptom paradigm. So the medical doctors say you have this symptom, here's a pill to get rid of that. In our world, the symptoms are an indication your body's trying to heal something. And what we do is we try to elicit the symptom and help the body and guide it down a path of healing those symptoms. You want to consider how many times a year you're seeing your doctor. Do they really know you? Are they in touch with who you are? Do you walk in and say, "Hi, Mrs. Johnson, how is your cancer today?" Or, "Hi, Susie, how's your thyroid today?" Are they labeling you? Are they addressing you as your condition, or are they talking to you as of your person? Like, "Hi, Mrs. Johnson, how are you feeling today? How's life? What's your stress like? How are you pooping? How are you peeing? Are you sleeping at night? What's your stress like?" Things like that, which is what we do here. So if you think about prevention is not a common tool used in the general Western medicine, medical society. It's just not part of the wheelhouse. They tend to try and span every aspect of it, but when you think about it, the way they're trained, it's really about emergency medicine. The problem is when you use emergency medicine over the long term, trying to treat chronic conditions with acute care or acute medications, it usually ends up causing a losing proposition for the person who's being treated. Just some things to consider as we move forward, because these are pretty important stuff. Or this is pretty important stuff, rather. So 6 things you want to sort of check and see. Check these boxes off, and maybe they'll help you determine if you've been misdiagnosed. Does your intuition tell you that there's something wrong and you've been told there's nothing wrong? That's really important, because if something doesn't feel right here and all you're being told is, "Oh, look at your lab values here. This is perfectly fine. You're totally within normal values." But you can sense something wrong in your body, follow your intuition and keep digging, keep looking for someone who can help you understand what's going on and give you a real root cause and help you solve that, instead of just simply saying, "No, you're fine, your labs are good." Your doctor won't listen to you. If you go in there and it's a confrontation and you're asking questions and they're not willing to talk to you and you're not willing to listen, that's a problem. That may mean that you're challenging their authority and they're more concerned about whether you are actually following their directions and they're in the right, or if you're challenging their opinions as medical professionals and you're telling them they're wrong. The human psychology will default to that. If a person feels challenged and they're in an authority role, they'll say, "Well, wait a minute, I know what I'm talking about." And they'll actually defend it even if they are wrong. Even if you give them the opportunity to reflect on it, they might not be right. Information that you're receiving or finding out through searches and stuff like that is indicating to you that there might be some other diagnosis or some other meaning behind your condition. So look for further information. We talked about pills, and more pills. Pills for symptoms, pills for side effects, and pills for more pills. Okay? So just appreciate if you're getting more pills on more pills and more pills, and you're not getting any better, like you're 3 medications in and you don't feel any better, you're actually getting worse, you might want to consider that it might not be the proper diagnosis, not right medication, wrong dosage, whatever it might be. So definitely dig in there and don't just accept carte blanche, whatever they're telling you to do. Attempts to talk to your doctor where they're not listening or they're really resistant to engaging with you. If you can't get time with them, if they're not spending more than 3 to 5 minutes with you as far as checking your meds and your vitals and saying, "Oh, looks like you're pretty good, we'll check back in 3 months." A number of situations I've seen like that are pretty staggering. So what do you want to do to make sure you're not misdiagnosed? So I've created a bunch of different ideas. First and foremost, educate yourself. We call it Googleicious. Go on Google and type it in. You can check Bing or Yahoo, whatever, but I prefer Google because there's more scholarly data as far as accessibility there. Know what questions to ask. Know what lab values you need to have run if you want your blood, urine, or saliva tested. You can contact us for that information if you want more of a comprehensive view on that. Bring a copy of all your relevant lab work or your tests that you've had in the past with you to your doctor so that they can review that. And make sure that they review that though, so they're not telling you, yep, looks, everything's fine. Make sure that they have an appreciation, especially during your initial intake. Bring a short written description of your current health history as well as your past history. And if you need to, bring some of your family history with, like my uncle died of cancer, my dad had diabetes, and my mom had heart disease, and whatever it is. That's the health history. You want to bring that with. Always bring a list of your medications and or your supplements, depending on what you're taking. That's very helpful for people. We have people bring bags of stuff in here that they've been trying to heal themselves with for a long time. We always applaud them for doing the best they can. We can always also save them probably 4, 5, 6, who knows how many hundreds of dollars a month by cutting down what they're taking because they're trying to fill in so many holes based on what they've read on the internet. The problem is that they're doing the self-diagnosis and they're doing the self-recommendation or this marketed product is the best thing since chipped ice and sliced bread and everything else. And it's fantastic. So they decide to take it, even though they're having an adverse reaction. You've heard of the placebo effect. Your brain will actually continue to rationalize a reaction in your body if you keep telling it that this is good for you. Okay? It's an interesting phenomenon. But if you can bring a progress charts are great. We oftentimes have people monitor what they're eating, what they're drinking, and how they're pooping and sleeping and exercising, things like that over a week long, which helps us understand how they're doing as far as their progress and what they're doing in their own time. Because we only spend 20 minutes every 2 weeks, or it depends on how we work with someone. It just depends. Be specific about your symptoms. Don't think that a little bit of information is enough. You want to last week I had normal bowel movements for 3 days, and then everything dumped out for 3 days, and it went back to somewhat normal, but then it went back down and up and down, up and down. And if that's somewhat normal for you, because some people have this all the time, you go into your doctor and you say, well, things seem to be normal. For you, that's normal, but that is definitely not normal as far as what we'd expect from this person's bowel movements, just to give you an example. If you are told that your symptoms are normal, insist that this is not normal. Okay? No symptom is necessarily normal. And if you're not enjoying life to 100% of what you have capable of, and you're feeling crummy, that's not normal. A headache is never normal. A loose bowel is never normal. Okay? Maybe 1 or 2 circumstances I can think of that might be if you're trying to flush something out, but in the absence of something attempting to push it, it's not normal. So don't accept it's all in your head. People are told all the time, you should probably refer to your psychologist because this is definitely not a physical problem for you when your labs are normal and you keep insisting, I'm not crazy. I'm not crazy. This is not in my head. And they're like, oh, here's the number. Then they'll label you in their chart. They'll say, problematic patient, ask too many questions, volatile, aggressive. They'll actually label you in your chart. So be very careful, be very mindful. Always keep a cool head because cool heads prevail and get that information to them without becoming, the one that they're labeling as manic because they might lock you up in a padded room somewhere. They're capable of just about anything. Don't let them downplay your symptoms or your pain. It's been proven in scientific studies that they will downplay girls' and women's pain because they think if boys are complaining about it, it must be real. But girls are somehow whiners, okay? Well, having lived with one and, now 2, you don't want to make that claim, okay? It doesn't end well for you, no matter if you're male or female. Because what you want to appreciate is that a person's pain is a person's pain. And your form of pain or your level of pain might be a 2 for me when it's an 8 for you. You can't make a claim like that. So be careful for someone dismissing your pain and things like that. Bring someone with you. Bring a healthcare advocate. We encourage people to come all the time with their either their healthcare advocate, their spouse, a partner, whoever it might be, a parent even. Very important that you have someone there advocating because they can take notes. They can hear things that you might not hear. They can write things down that you might not grasp. But that's very important. Bring an advocate. Focus on the systems in your body and not on the symptoms. So focus on systems, not symptoms. It's hard to say fast. It's a good thing I'm slowing down. So what you want to appreciate is there are systems in your body that are interconnected, right? Your mouth goes into your esophagus, into your stomach, into your small intestine, into your small bowel, into your large bowel, and exits, okay? in that process, you have a bunch of stuff dumping in. Your pancreas is dumping in enzymes. Your liver is dumping stuff down into your common bile duct, into your gallbladder. Gallbladder spitting out bile to break down your fats and all this other crazy stuff. Your bacteria in your guts are breaking down your food to make stuff for you to use. And it's all this crazy stuff. But you have to think about your thyroid. And if your thyroid's sending hormone down to your liver and your liver's not converting your thyroid hormone because it's congested, and you have to think about it from a global standpoint. Take a step back, 10,000 foot view and say, how are all the systems interconnected? Because you can find out more information on the internet than the average doctor knows, which might scare you, but if you come in there armed and ready, you can flesh out a fake pretty quick. Someone who doesn't know what they're talking about, someone who doesn't have the skills or hasn't read. Statistically speaking, and this is not a blanket statement, but what they're teaching in medical schools is usually 10 years behind the research, okay, which is a pretty damning statistic. So always assume that they might not know, and it doesn't make a bad person. It doesn't mean they're trying to hurt you. It means that they may not know. I have to study constantly, and I can guarantee you I do not know it all. I will never claim that because, first of all, I'm smart enough to say the human body knows better than I do, and there's no book on the planet that can tell me about you. So when I think about how to help you and how to help your body achieve its optimal function, I look at how your body can function based on what it can tell me. So it's just a different way of looking at it. We found it very successful. You can read the testimonies and watch the videos. I mean, people will express that their lives change. So assume everything in your life is relevant. Everything. There's no detail that is irrelevant. It doesn't matter if you woke up and you sweat, you didn't sweat. If you woke up, it's a challenge. Okay? If you go to the bathroom, you didn't go to the bathroom. Everything is relevant. If you woke up, it needs to be expressed to your doctor. If you're having frequent urination and you're not drinking as much, that means your kidneys aren't filtering very well. If you're having headaches are never normal. Talk to your doctor about your headaches. Don't let them say, well, that seems like a stress type headache. Yeah, it might be, but what are you going to do about it? So consider that as well. Ask a lot of questions. I love when people come with questions. I will talk ad nauseum, as you probably already gathered. Who knows, I'm probably at 12, 15 minutes at this point, and this is like pretty much. But you got to ask a lot of questions because there's so much information you need to learn about your body. One of the things we're working on is developing the owner's manual for the human body, right? I'm pretty sure you didn't get it at birth. I didn't get it at birth, but it definitely can something that can be put together based on all the healing modalities of the planet because we've been around for a few thousand years, right? And so there's got to be a lot of information out there we can put together and compile into a database that says, here's the owner's manual of the human body and cover 90% of what's going on. The other 10%, you go see someone. It's pretty simple. Share your story with other people. Find support groups on the internet. There are Lyme support groups. There are ALS and MS and Crohn's and all the other support groups. There are meetup groups for these things, for gosh sake. You can find people who have had experiences and they can help you, first of all, know that you're not crazy. Second of all, understand that your symptoms are real and they're valid and you should be understood and be acknowledged for that. And B, they can help get you to people and or help you with strategies they've used to be successful in their lives. This can be very helpful for you as you move forward and navigate your waters until, of course, you get to the point where you're stuck. Then you find someone like Secoya Health and we help you break through. And that's pretty much simple. If, in the end, you have to switch your doctor. And I would say in the axiom of human resources is an old saying that says, hire slow, fire fast. Okay? So be slow to hire your doctor, be quick to fire him. Okay? If you don't trust them, if you feel like you're being dismissed, if you feel like they're not being heard, if they're downplaying your symptoms, say, you know what, this doesn't feel right. Our culture does not encourage us to sense like what's our intuition say. So you need to feel right. Okay, does it feel right working with this person? Does this make sense? I acknowledge I'm not everybody's cup of tea, so I'm okay with that. People don't like my style, that's fine. There's someone out there that can help them. Let us help you get to them, whoever it might be. But really, there's going to be someone out there that is willing to do what it takes to help you get where you want to be. But you have to be willing to put in the work in order to accomplish that. So just appreciate that. So my motto is ditch the diagnosis. I ditched the diagnosis of asthma and eczema and all that other garbage and irritable bowel syndrome because they weren't helping me with their diagnosis. Their drugs and corticosteroids and all the other garbage couldn't help me. So I said, yep, thank you very much. I'll check my allergy and asthma specialist and I'll see you later because they said my symptom or the benefits of my medications were outweighing the risks I was facing as far as bone demineralization and immune suppression and all that other garbage. I just wasn't willing to accept it, and that's what kind of pushed me in this direction. Having been born to a mom with MS and lived in a family with dysfunction, I'm going this way when everything else is pushing me that way. So you have to make a decision in your life that this is going to be your path. You get to decide this is what it's going to be for me, not what everybody else decides for you. If you do accept the diagnosis, I would strongly encourage you to not accept the prognosis. And what that means is they can label you, but don't let them tell you what's going to happen after you've received that label. Like people with cancer all the time. I just had a consult with a young woman the other day. She's had cancer 3 times, and they basically told her you have stage 4 cancer. It is metastatic, which means it's spread around the body. And basically, that's all you can do. And, get your affairs in order. It's coming soon, the end of days. And no doctor, I don't care what initials you have after your name or their name, can tell you or anybody you love what's going to happen, okay? Don't accept it. So if you want to accept the idea of the diagnosis, do not accept the prognosis. Okay? Don't accept what they think is going to happen to you, because they do not decide. It's between you and something else. Some people call it God, some people call it the universe, universal intelligence. I don't know what it is. It's pretty magnificent. It runs the whole show, and I trust in it rather than trusting in me to make every right decision. So it's called living by faith, not by sight. At any rate, give us your questions. Let us know what's going on. Give us concerns, like does this make sense? Do you have serious concerns, like what does this mean? How do I navigate my waters now? Share with your friends and family. Help them be more empowered to take their healthcare into their own hands and be empowered to say, you know what, I'm driving this ship. The doctor works for me instead of me working for them. Okay? Don't let them tell you what to do. You put their feet to the fire, make sure that they are empowering you to help yourself, because that's what you got to do in this day and age. It doesn't make them bad people. If they are resistant to that and they push back on you, then you're probably not the right doctor for you. Okay? Next week we're going to be talking about the big C word, as everybody knows, cancer. Yeah, it's a dirty word. Everybody thinks that they can chase it from the ovary to the uterus to the breast to the prostate to the colon to the thyroid or wherever else it is. We're going to talk about where it really comes from. Okay, so next week be sure to tune in and share your comments with us in the interim so we can provide more information, and let us know, as I ask every week, please let us know the topics you want us to speak on and provide information. If you want to see some type of condition worked on, I'm happy to do that. I love to watch me do videos. I love them. I'd love to help you understand how you can help yourself. So let us know what it is. There are no limits. I mean, if I find a limit, I'll let you know. But I can't think of anything right now. So give us a thumbs up if you like it. Give us a thumbs down if you didn't like it. Whatever we can do to improve, just let us know. All right? We appreciate it. We'll see you guys next week for the Wednesday Wellness Minutes. Bye-bye.